guys, so this is week 10 after my jaw surgery. I think this week I'm going to talk about pre-surgery and maybe just the surgery itself. So before the surgery, I met with my surgeon just a few times. I want to say maybe like a year beforehand, before I even started the whole process. I met with him for like an hour. And then after that, really, it wasn't until just maybe 2.5 months or 3 months before the surgery that my orthodontist said, okay, I think you're ready to go back and, have your update with him. So I went over there, and that whole time, the surgery coordinator was making sure that the insurance would go through and everything like that. So I did have a lot of contact with her in that regards, and that was really helpful and really nice and made me feel really secure about it, money-wise. And so I went in for like a little checkup thing, and then I went in maybe 2 months beforehand for more checkup, and then maybe a month beforehand, they took molds and they started talking about all the things that I would need to do to prep for the surgery. So I would say at that time, he gave me a prescription for iron pills and folic acid, which I was supposed to be taking every day until the surgery, and then finish the bottle afterwards. So it would have been a couple weeks after the surgery. I didn't do it after the surgery. Yeah, there's so many pills, and like I couldn't handle smashing it in a mortar and pestle and things like that. And I probably should have done it. But in my understanding, it was more for the surgery itself. It was like the iron is to increase your red blood cell count to make sure that you're like nice and healthy for the surgery. And if you lose blood, you're going to be okay, which I guess I should take an after too, but I didn't. So, yeah, so it was a ton of iron. I want to say it was like 325 milligrams or grams or whatever, milligrams of iron per pill, and I was supposed to take 3 pills a day. It was crazy amounts of iron. So along with that, I got some Colace to help things go. And I never had to do that before. But so they said, okay, start on 1 pill and then with the iron, and then 2. And then if you get up to 3, that's awesome. But if you can't, then, you can't. Because it just really like stops things up, kind of. So I think I took 2 pills a day for, a month. And then, yeah, there's a lot of appointments that you have to go to. So like a week before, I had to go to get a physical, and then had to get my blood taken and things like that. And they had to make sure I wasn't sick. And the day before the surgery, I had to go back. So I think a week before, when I went to go to the surgeon's office, that's when they really gave us the details about what would be happening during the surgery, and then what I would need to do after the surgery. So they gave us, a little recipe book and things like that. I don't know if it's so helpful to people who are health conscious and know what they're putting into their bodies. I mean, I eat In-N-Out and stuff, but I do know the difference between carbs and protein and fat, and I know what percentage I like to have in my body. So anyway, yeah. About the day before surgery is when I went to the hospital and checked in early. And then I also went to the surgeon's office to pay a portion of my payment, and also do like some last minute checking of the splint, I think. And I also went to my orthodontist's office, and he put the hooks on, the surgical hooks. So his surgical hooks, if you look in my blog, were different. So I know a lot of them, like, they're like metal things that they put in between each tooth, and there's like 10 on top and 10 on the bottom or something. He basically, every time it didn't, like, my bracket didn't have like a little hook, he just made a little metal loop thing around each bracket that didn't have that. So it was free. I didn't have to pay for them like some people did. They're like, oh, each one of these is, $8 or something. But he just did it by hand, and it didn't take that long, and it wasn't that intrusive to my mouth and the way I talked and stuff. So yeah, that was like the day before. So a lot of things happened the day before. And then I wanted to kind of read you a list of what I took to the surgery and what I bought for home. My list is pretty comprehensive. I looked a lot online, and I just like consolidated everything. But I'll tell you what I got and if it was helpful to me. And I think that a lot of things weren't helpful for me because I didn't get upper jaw surgery. So something like the breathe right strips, I wouldn't need that because they're not doing anything to my upper jaw. So I didn't really have like nose issues and breathing issues and things like that. But I got them anyway, and I think that for this kind of surgery and for most surgeries, you want to be as safe as possible in that just buy what you think you might need. And if you overspend by $20 or $50 or even $100, it's worth it. It's worth it to not be in constant pain for 2 days while you're waiting for your Amazon to deliver, So, okay, so things I bought before the surgery. Extra pillows. So I bought like super jumbo fluffy ones. I bought 2, but I would recommend 4 or more because they're so cheap. Like you go to Costco and like $15 for 2 of them. Aquaphor and A&D ointment. I got both of those, just I didn't know which one was better, so I got like a little tube of each. I ended up using the Aquaphor more just because it was downstairs with me, and the A&D was like upstairs in the restroom, but I just felt like, oh, I need to have both just in case. You only need one of them. The jaw bra. I love my freaking jaw bra. I only really needed it for like 2 weeks or something, maybe 3. Now when I ice my jaw, I just take one of those ice packs. I just hold it, and I hold it on the other side. I hold it on the bottom, and I just, until it's not icy anymore, and then I take another one, and I do the same thing. Very rarely do I have to ice anymore, but recently I have had to because I started getting puffy again. I started working, and there's a lot of talking and walking and things like that. Okay, so jaw bra, awesome. Don't forget to buy gel packs. Even if it comes with gel packs, buy the good kind. So go on my blog. It's like my second post, and I have all this stuff posted there. And then also a water pick. Obviously, you need a water pick. I already talked about that. A real one. And then a NutriBullet. I love my NutriBullet. I've had it for a while, but it was amazing. For myself, I use the NutriBullet, but we also bought a Vitamix. Is that it? The fancy expensive one. We bought like a refurbished one, and that one I never ended up using, but my husband used it. So he would make me basically like chicken soup, and he'd add all these vegetables to it, and then he'd blended it up, like he pureed it up into this crazy smooth consistency. So I could basically spoon that into my mouth, or heat it up, add water to it, and then squirt it in. But it was great. So I had like that, a whole pot to myself. And he also made me oxtail soup. For all the nutrients and stuff, and then he would puree that up, and it just comes out so smooth. It's not a regular blender. It's amazing. So that was really, really helpful. It basically destroys food. And then we got some protein powder. I got vanilla powder, which I didn't really like it before when I used it to work out and stuff. And then, of course, I didn't drink it later because if you don't like it before, you're not going to like it after the surgery. We bought chocolate, what's it called? I have always liked the muscle milk. So the like light muscle milk that's already in the containers. So we get that from Costco, and I like it to put in drinks and stuff like that. Like I'll blend that with uh kale and like peanut butter and ice and banana and things like that. So that was really, really helpful. I still drink that now. I drink it every morning for breakfast. Soylent is crazy. I know it sounds crazy, but I read about it like 3 years ago and thought it was crazy. And then my friend recommended it like as a joke, and I ended up buying it. It's not terrible, and I did drink it, but I only drank like 2 bottles. I had to buy 12 at a time, so I bought 12 and I drank 2 bottles. Um, it tastes like milky chalky milk, basically. Like it tastes like um, milk after you have cereal in it, and then a little bit chalky. So it's not really tasty, but it's not terrible at all. And it's good just because it's not sweet. So I also ended up buying Ensure. My husband got it for me because we didn't bring anything to the hospital, and then the hospital kept giving me like broth and things that, I mean, it just didn't have like nutritional value, a lot of it, because it was liquid. So he bought that. I tried it once and it was disgusting. It's like a fake milkshake. It's like you take a milkshake, but it's all diet flavor and not cold. So it was sick, and I had one sip, and I was like, I can't drink this. Um, Baby food pouches, I am still using. I think we only got like a pack of, oh, now I don't even know, like at least 24. Um, but I would have a couple each day, maybe 2 each day, and then we still have like 2 left over. I had one yesterday because I was too lazy to eat normal food. And then, oh, a neck pillow. I bought like the best neck pillow I could find. I think it was like $40 on Amazon, and I used it twice, and I decided I didn't like it because it actually, like the neck pillow, your jaw rests on it. So for me, it just wasn't very comfortable. Okay. And then I also already had like boxes of mashed potatoes, which you need, Greek yogurt, whole fat milk. I drink a ton of that. A lot of beef stock that my dad bought me, farm fresh eggs. I had a lot of fruits and vegetables that I would add into things and blend, and a giant jar of white truffle cream, just cause if you're gonna, not be able to eat, you might as well flavor things to your liking. Okay, so that's what I bought to prepare for the surgery, and then what I took to the hospital. So these things I took to the hospital. A small pad of paper and pen, absolutely necessary. And you don't want a pen that you have to like open and close like this. You want a clicker. Phone and charger, yep, absolutely necessary. Fuzzy socks, no. A different outfit than I went in with, nope. An iPad, didn't use once. A Kindle, haha, no. A sheet of paper with questions and concerns for me to point at. So some people had like, I'm thirsty, I need to use the restroom. No, I just pointed. Or I went, I'm thirsty, I want water. And then a small mirror, nope. Face wipes. I didn't end up using the ones I brought, but I was given some after I puked by the nurse's assistant. So I ended up using that, and it was really nice to have. So you probably want to bring some on your own. And that's all I have. So again, that's the second post on my blog. And you want to be prepared, you want to be over prepared. You don't want to be sad because you didn't bring something or you didn't think something was going to happen. And then I think next time we'll talk about the actual surgery itself because this is a long video. Okay, have a good couple weeks, and I'll see you later.